All right, well, welcome back to the fourth panel session of the day here at the inaugural Women's Health Expo. We are thrilled to have so many people in the room, but we're also thrilled to have lots of people live streaming this event, so welcome. We are here on Gadigal land, and we would like to acknowledge the traditional custodians of the land, past, present and emerging. In this panel discussion, we are going to be talking about women having it all, managing their health, managing a career. The Minister for Women earlier, Bronnie Taylor, spoke specifically about menopause and the fact that there is still a little bit of a taboo around that subject. So that's what we're going to talk about in this panel. And to do that, I'm joined by three fantastic women. I've got Trudy Phelps here from the Cancer Institute of New South Wales. We've got Dr. Elina Safro from the Australasian Menopause Society. And joining us from Zoom, I believe, is Janet Michelmore, from the Jean Hales Foundation. So welcome to you all and thank you for being here today. Dr. Safro, I'm going to go to you first, and I'd like to ask, how do you think we can help women to feel confident in managing the menopause transition?
Well, goodness, it's a big question. I think the basic thing that unites the time of midlife, menopause, and the time before that time is this constant change. I mean, the previous panel talked about the changes to do with motherhood and being a new mother and trying to function in society as a new mother. I think it's just an ongoing thing. I think women get it hard. It's an ongoing change of life. And it comes at different times of life and it comes in different shapes. And just like with motherhood, no experience is the same for any two women. And just like with motherhood, everyone has their own unique story and it changes. You go through stages and you adjust. But I suppose also just like with motherhood, in menopause, it's a question of whether you're just kind of dragging the chain and surviving, remembering that you've got, 35 years of this with the current life expectancy. The same actually as the reproductive time, 35 years. So whether you're just surviving and just bearing it and keeping a stiff upper lip, or as they say, thriving. And I think it makes a huge difference to quality of life and to what women can offer to society at any stage of life.
Yeah, absolutely. So in this panel discussion, there are a few topics that we're going to cover off, and they do include menopause, but also all of the parts that are connected to that, which includes stress, includes sleep, exercise, diet, prevention. And Janet, I'm going to bring you in here now and ask, what sort of behaviours can women build into their lifestyle now to help with their health and well-being in the longer term?
It's such a great question, Georgie. I believe that wellness is really worth chasing, and prevention is really worth working for. And I think it's better to seek remedies before the body starts breaking down or you're getting older. And it really is about what you can do for yourself. And my first recommendation is value yourself, because as the advertising agents say, you're worth it. But the first is find yourself a good GP. See them as an equal partner in the business of keeping you well. Build a relationship with them. When you go to see them, prepare for your meetings. Take a list of what you want to talk about. Be able to talk about all the medications that you're taking. Some of us feel really embarrassed if we're taking things that we don't think our GP will approve of. But it is really worth developing that relationship, just as you would have a financial plan. It always interests me that we take our dog to the vet, we take our kids to the dentist, we take our car to be serviced, but where are we on the priority list? Either not there at all or way at the bottom. And I think that's the crucial thing for building the foundation of a healthy life for those 35 important years post-menopause. In terms of physical well-being, there are two things I'd like to talk about. One is physical activity, moving in the right direction, and healthy eating. And really it's about your health is on your plate. And last but not least is emotional well-being and making sure that stress and lack of sleep don't have a negative impact on your health.
Yeah, thank you very much for those wise words. And I do like that framing of it, to sort of, you know, be investing in your own well-being as a sort of conscious choice. I think one of the other things that you did touch on regarding the GP, one of the comments that was made earlier that is really important, I think, is if you have got a GP who you don't feel amazingly comfortable with, find someone who you do, because I just think it's going to make those conversations easier. Now, and particularly if you're looking at it as an important partnership in the business of keeping yourself well, it's worth trying to find a GP who you really trust and feel empowered by. Trudy, I'd like to talk to you about the sort of routine screenings and checkups that are really important for women, particularly in midlife.
Yeah, so I'm going to again refer to the importance of cancer screening. One of the most important things a woman in her life can do, especially over 50, is to participate in regular cancer screening. We are very lucky in this country to have 3 excellent screening programs: cervical, bowel and breast. And I will draw out my friend here and just say, I often say that you can lie to yourself about your age, but you can't lie to the Cancer Institute. Because when you turn 50, that bowel kit is going to come through the mailbox. And I urge you to do it. They do arrive, people put them aside, they get dusty and they expire. Do it as soon as it comes. It's really important. Every 2 years, we will be sending you your kit. Every 2 years, we will be inviting you to have a mammogram. Significantly, most of the women who are diagnosed with cancer, say breast and bowel, they're not experiencing any symptoms. So being proactive and staying on the front foot in relation to your health is your responsibility, and it's a shared responsibility. I really urge it. Cervical, as I was talking about earlier this morning, between the ages of 25 and 74, have a cervical screen every 5 years. Really important. Early detection of cancer leads to better treatment outcomes and improved survival. Really does. So,
Trudy, I can't tell you how excited my children would be if I said that at the event I was at today there was an actual poop emoji, which is their favourite.
of course.
You know, it is. But yeah, I mean, it is interesting how, I don't know why it is, like why we have the resistance around. I mean, obviously, we're not going to say it's necessarily a mammogram, might not be everybody's idea of a great time. And yet, why do you think there is that sort of reluctance sometimes to do the things, even though we know they're critically important for us?
I think, you know, no one really wants to do them, and that's okay. It's just important to do them. Choose the things that you don't want to do carefully, because they should be on the list. I also think we have to be careful of mistaking wellness for immunity to cancer. If you're feeling well and on top of your game and you're healthy and happy, that isn't really a reason not to have regular cancer screening.
If I could just add to that, I find that many women in midlife will delay the screening, even though, you know, Cancer Institute does a great job sending out those reminders. People delay these things because I think there is quite a lot of anxiety underlying specifically breast cancer screening, and people just feel so on edge actually waiting for that result that comes soon enough, that it's this kind of avoidance reaction. And I think it's our role as GPs and health nurses to gently encourage people to do it and actually make it clear to them that, most of the results are normal because screening is for healthy people. They're not symptomatic. And I think if you can just allay people's anxiety and emotion, it goes some way towards promoting kind of a more healthy attitude to this whole screening process. Don't you think?
Yeah, look, take someone you love for a mammogram. Seriously, assist someone you love to get going with their bowel kit. Reward someone who's had their cervical screen. Like, they're the things that we can do as a community to support each other.
Yeah.
Janet, you touched on this earlier when you were saying, the list of jobs that that a woman might undertake, from, taking the dog to the vet, the car servicing. How much of a role do you think... I think that we all accept that women are particularly time poor. We know that women still undertake the sort of vast majority of unpaid care work. They're looking after elderly relatives, they're looking after little children, they're doing that sort of volunteer work in their communities. And I think one of the side effects of that is that a lot of women do put themselves quite low on the priority list. How do you think we can sort of address that culturally together to sort of encourage women to actually put themselves front and centre, particularly their health?
Look, Georgie, I think it's such an important topic. We know during the last 2 years that screenings really, and particularly in Victoria, but also in New South Wales and other parts of Australia, they went way down because women had, as you rightly point out, so many other things to do. I think we've grappled with this a lot at Jean Hales, and our national survey indicates that women are so time poor, but it's still seen to be a bit selfish if women take time out for themselves. And look, the airline safety kit people, they do it so well. Put the oxygen mask on for yourself before you attend to your children or other family members. But somehow we haven't got that message that actually doing the screenings, and I agree with you, wellness and cancer, that is, you can feel well but still you need to do the screenings. But it's not selfish, it's actually meaning that you can give the best to your work, the best to your family if you do it. But it's a completely different mindset of selflessness and selfishness. And I think we've got a long way to go. But encouraging women that this is a long term. We're looking at the long haul here. We want women to stay well so they can contribute as beautifully as they do now, but for much longer. But it's going to take a lot of encouragement. And I agree, anxiety underpins a lot of the reluctance to get going. To open that wonderful envelope when you turn 50, you've got to read the instructions and think, right now I'm going to get onto it. Much easier to put it at the end of the kitchen bench. So it's about having the ability to put yourself first and believe in yourself because you're worth it.
Yeah, absolutely. I think it's such an interesting phenomenon that as women, we do tend to be in sort of primary caring roles. We do take care of the people around us, and it is really fascinating to me how difficult lots of women find it to put themselves and their health first. And I mean, I think that the importance of screening and also that sort of relationship, as you've both pointed out, around wellness and cancer. I mentioned earlier in this session that because I have Crohn's disease, even though I'm not over 50, I have to have bowel screening tests. And during COVID, my procedure was cancelled because it was, elective, and so it was put off. And it was only put off by about 3 months. But when I did have it, there was a polyp that was found that was really problematic. And I was not sick. I did not feel well. If I hadn't have had that, it could have been much worse. And that's something that, for me, was a real wake-up call. And now I have to have screening procedures very, very often, every 6 months. And I don't like doing it, but I do it because I would much rather be forewarned than be caught off guard. And I think that's probably a conversation we do need to be having, that it's not only if you feel sick that there could be
Absolutely. And I don't think it's not a perfect world. If you have not had a screen or any one of the screens that you need to have, step forward. There's no finger pointing. Step forward and follow it up. There's no shame in not having participated. We're really looking forward to seeing you at any time.
I have to say though, when I was preparing for today, I looked up some numbers because that's what doctors do, they present numbers. I was actually struck by this little statistic here. Last year, 40% of all general practice consults involved women in the age bracket of 45 to 54. How's that? 40%. And I would think that it's safe to say that many of them actually do follow up on their screening, which is good. But I also think it's safe to say that they were there for symptoms of menopause, which may or may not have been managed correctly. Yeah. So it's a huge number. You know, almost half of the general practice consults involve women in this midlife time.
How interesting. And when it comes to sort of, you know, you mentioned there that they might be seeing a doctor and not being treated appropriately for menopause.
Yeah.
Bronnie Taylor, the Minister, referenced that this morning.
Right.
What is the situation, do you think, for women when they are seeking help, when they are actually in the midst of menopause? And what advice do you have for women?
Well, it's a big question. But I think on a basic level, I think the problem is two-pronged. On one side, you've got women who, let's say, they were well educated before puberty about changes of puberty. So they entered puberty with some sort of level of confidence about what's going on. Then, you know, we've got excellent motherhood services, for example. And so women go to prenatal classes. They prepare a little bit for what's coming. Menopause comes. I can safely tell you, nobody knows what hit them. And luckily, we will have, again, a little statistics. 1 in 5 women will kind of sail through it and they're fine. And then there will be 1 other in 5 who will have such severe symptoms that they will severely affect quality of life, meaning can't work, can't live, becomes very difficult to live with, relationships break down, can be very hard. And then the other 3 out of 5 have a degree of symptoms which can vary over time, right? And so women are not educated until they actually come face to face with it. They can't really tell what's going on, right? Because that final menstrual period, you know, the menopause, doesn't come just like that. You can have up to 5 or 6 years in that time when the estrogen starts to drop and comes down, and then the symptoms start to appear. But if you don't know what you're looking for, you just feel rotten, and different things keep coming out, but you don't really know what's going on. Happened to me, okay, truly. And I think there needs to be, on one hand, education for women, just to forewarn them, not to panic them, but just to tell them, you know, this is coming and look out for these things and ask for help. And on the other hand, you've got doctors, and most general practitioners I know are excellent, but most of them will feel a bit of a heart sink when a woman comes in midlife with this whole shopping list, as Janet suggested.
Yeah, Janet's laughing.
Shopping list of those symptoms which may or may not be connected and may be due to different things. You know, anxiety could be due to so many things in our life. It can also be a direct symptom of menopause. You know, hot flushes we know about, but there is a whole lot of other things, you know, sleep disturbance, anxiety, which is so disabling that people cannot work, cannot look after those multiple, you know, people that depend on them. And GPs need greater education as well. I have to say that one of the most used resources on the Australasian Menopause Society website is on the landing page. It's got a little search bar there that says find NAMS doctor, right? So we collect the names of the doctors in different areas who are interested in menopause. And women are so grateful when you direct to those services in that area, because it's really difficult to find someone who has a genuine interest, because I believe it's one of those areas of health that unless you have engaged deeply with it, personally and professionally, you probably cannot provide the best care, even with the best intentions.
Yeah. Janet, I'd be interested.
I couldn't agree.
I was actually going to ask you then, and obviously make any comment that you have, but I know that the Jean Hales Foundation is a critically important and rich resource for information. I was interested in what you see people are searching for the most. You know, what are they interested in finding?
Oh, absolutely. They come to our website, which is jeanhales.org.au, to look for what are the symptoms of menopause, how can they manage it, any symptoms they've got. And we encourage women, if their symptoms are affecting their daily life, to please go and see their general practitioner. We have lots of resources in multiple languages, fact sheets, we have videos, we have podcasts, and we have longer feature articles. And all of that is to offer women as many learning opportunities as they need to get the most up-to-date information. I think some of the concerns are raised. Look, Dr. Google, we all know some of Dr. Google isn't quite as reliable as we'd hope. And I would really encourage women to go to reliable sources like the Australasian Menopause Society, like Jean Hales, so that it is absolutely evidence-based. It's the most up-to-date information. And on our website, we have so many resources for women that I'm sure that there'll be something there that will fit into your learning style, and particularly our availability of fact sheets and resources in multiple languages.
Yeah, that's fantastic. And I mean, look, if we've learnt nothing through this pandemic, is it not the importance of evidence-based research and, you know, strategies, everything, for, you know, turning to trusted medical advice is so critically important.
I agree. I have to add to this, if you don't mind, my last piece of useful statistics. I just Googled menopause. I just plugged menopause, the word, into the search engine. Can anyone guess how many hits came up? 9 million, right? And most of them, I actually went through each single one on the first 2 pages of the Google search. They were all direct marketing of things that we know either don't work or can be downright dangerous and cost a lot of money. Mm. So you need to go to evidence-based resources. And as Janet correctly said, Jean Hales and Australasian Menopause Society have resources for the health practitioners and for the health consumers.
Mm, yeah, fantastic. That is a terrifying proposition,
9 million.
Isn't it? Because also the other thing about online is things can look very credible. Mm. You know, they can, and when you're looking for an answer, you can understand why some people might just jump onto the nearest, you know, to the first link that pops up. I am going to open to questions. If anyone has got any questions for any of our panellists. Yes, we have got one down here.
I was going to ask, so you talked about just
let's be official and get a microphone so that our live streaming audience can hear too.
So you talked about that young girls are educated about puberty through schools and those kinds of things. Is there opportunity to educate women through their midlife in different kind of public spaces and work about menopause? And is there any programs out there that are already addressing that?
I'm not aware of any programs. I think it's a very sensible question to ask, right? There's a few barriers to that because, you know, puberty is one of those exciting times, right? It's a time of change. It's a hopeful time. Menopause can be a bit of a downer as a subject. Okay. And it's exciting for me, right, as someone practices medicine and I've seen how women can be helped with good treatment. They actually come back a few weeks later and say, you've saved my life, right? But for normal people, it's not the most glamorous subjects to talk about. So I don't really know how you write specific programs other than just including it in the conversation. We know this is happening, this is the change, this is not the end of life. You need to do all those things that Janet and Trudy talked about. But in terms of actually participating in society, I think a very good thing has been happening. And quite a few workplaces have contacted us to talk to women about the change of life. And this has been driven by the fact that there are so many women of working age actually, you know, getting to the top of that glass ceiling around the age of 45, 50, and then they hit the wall. And the organization is actually interested in improving their performance and actually keeping that amazing talent going. As we talk about delaying the retirement age, you know, we cannot afford to waste that resource, which is amazing women with amazing skills. So we have been discussing writing programs and actually presenting to different workplaces. They don't have to be corporate, they can be resources, they can be all sorts of places. And so I think this is one thing we should be doing a lot more. And there's also quite a few executive health outfits that specifically approach people who are interested in midlife and ask for specific little webinars and talks. And it seems to be working well. I think we just need to keep it up kind of within the public discourse. Yeah.
And can I add something there, Georgie? And that is during this year's Jean Hale's Women's Health Week, one of the big key themes for it will be midlife, menopause in the workplace. So that's in the first week of September. And if you Google womenshealthweek.com.au, you'll see some wonderful promos for what's coming up in September. But as a spoiler alert, let me tell you, menopause is going to be front and centre of this year's Women's Health Week.
Yeah, thank you so much for that. It is interesting to me. So, as I've said a few times, I run a not-for-profit advocacy organisation called the Parenthood, and you know, one of the areas that we focus on is how can we support parents to be able to share the care, but also participate in paid work, and how does that all work? And there is a lot of work being done around the transition coming back into the workforce after having a baby. There's a lot of sort of investment. There are corporate programs, and I suppose it's interesting that this is another one of those opportunities where, and again, we come back to the fact that women represent, you know, we comprise more than half the population. We're not a minority group as a gender, and yet these health issues can seem like they're at the fringes or marginal, when in reality we've kind of got to bring them front and centre.
Yes.
Do we have any other questions for the panel?
And if I may add very quickly, Georgie,
Definitely.
you know, in this kind of age group that we're talking about, 80% of women are in paid workforce, some part-time and some full-time, at all different levels of workforce. But the big employers of women are education sector, right, healthcare sector, and then there is retail. And I have to say that at least in the education and healthcare, these are the kind of skills that you can't learn over a week's workshop. These are the kind of skills that take a lifetime to build, and we cannot afford to just let them go.
Could not agree more. I could not agree more. We need to ensure that our healthcare workers, our education workers remain employed and supported and engaged. Yes.
Look, I think much of our conversation today has actually come back to the word, Georgie, that you've said is about destigmatising. And when we look at mental health in the workplace, domestic violence and now menopause, I think it's refreshing to see that, and perhaps it is because there's so many women participating in the workforce in the more senior years and retirement is delayed. So I think the strategy around September that you're talking about at Jean Hale's with the workplace strategies and how it dovetails, in fact, with transitioning to parenting is actually, it's like looking at a continuum of care of women in the workplace. So whilst it's all about in the workplace, things that are around partners' expectations, you know, the mood swings, the fatigue. So where do we start with educating? I know ourselves as women is one thing and workplace is another, but the partners and the people that are living with people going through menopause.
That's a great question.
Yeah, well. It's a big ask. I think, I mean, I don't have all the answers, right? I don't do policy. What? I do health. What? I'm sorry, I'm just a doctor. But I can tell you one thing that has worked in the past. When women come in, and they do come in a lot with menopausal symptoms, you need to be aware that there are certain things that they're not going to bring up unless you ask them specifically. So there are certain things, talking about destigmatizing, right? It seems to be okay in Australia to talk about hot flushes because everyone knows about hot flushes. So that's kind of above board. But then there is all this other stuff which actually concerns partners. So there's relationship stuff, there is the lack of libido. And, you know, it's at the time of woman's life when she's very vulnerable. then there is a whole lot of very unpleasant genital urinary things that happen, which can be helped really well. But women won't bring that up unless you actually ask them. And when you do, it provides a very good hook about asking, how's things at home? You know, how's things going with your partner? How's the kids? And I think then you can just say, if she says that the relationship is actually not going really well, then you can explore it a bit more. I don't really know how else I would do that. Yeah.
Janet, did you have one other thing? Did you have something to contribute there? And then I think we're almost time to wrap up.
I do, but I absolutely agree that partners understanding what's going on is crucial. And one of the things we're looking at is developing programs for partners so that there is a much greater understanding, and that actually, just as you talk about asking a specific question in a consult, that partners can either ask a question, not try and solve the problem, but ask a question so at least it looks like they understand. And I think getting the conversation started is crucial to destigmatising the problem, but also supporting women who do have significant symptoms.
Thank you so much, Janet and Trudy and Dr. Safro for joining us today. I hope everyone has found that session informative. I think, gosh, there's a lot we could achieve if we just sort of move past the stigma. You know, it's almost as if we imagine there are people, magical unicorns born that do not have any mental illness, they do not go through puberty, they do never have a period, they don't go through menopause, you know. It's just not realistic, all of those things, that no one ever develops cancer. So thank you. I think there's a lot of good lessons there, and the first one is probably to feel comfortable to prioritise your own health and well-being, and particularly as you're entering midlife. Join me in thanking our panellists. Thank you so much. And we'll be back soon.